I had a lot of encouragement from my parents, and I had some role models that were wonderful people who were physicians. And I was a volunteer after I think the ninth grade in a hospital, and I just saw the opportunity of helping people. Well, once upon a time I wanted to be an internist, but I did a rotation when I was an intern or first year resident in GI, and I just loved it. It was a perfect fit for me. I take Pilates, I like to hike. We have 3 rescue dogs, and I like to travel. Children live in Palo Alto instead of Vienna, Austria for 3 years, so it's easy to visit them. 6-year-old granddaughter is a real delight, things like that. At the surgery center, we weren't very busy in the first month or 2 or 3, and the medical director is supposed to stay there all day long. He was an anesthesiologist. He and I had run a marathon together, and I lived across the street. I rented a house for a year and a half, and the chemistry was there. And we saw that when people would be hard to sedate, alcoholics, drugs, post-traumatic stress disorder, psychiatric people, his medicine always worked, and it wore off so quickly it was like magic. I went to the medical library, and I had sort of a epiphany because there wasn't anything in the literature. And after 3 years and 6 weeks, we got it at both hospitals, and then I started talking about it at national meetings and international meetings. My acronym NAPS, Nurse Administered Propofol Sedation, is the way this is described around the planet. Painless exams has become a guarantee, and rapid recovery. So from removal of endoscope to being back out in the car is 15 minutes flat, with rare exception. No nausea, clear-headed, cannot drive that day, nothing dangerous that day, nothing important that day, but back to ability to play chess or checkers in 15 to 20 minutes.